Life can be unpredictable, and planning for the unknown isn't easy. That is why thinking about and putting into writing your wishes for care at the end of your life are so important. Today, we'll talk to several experts about what advanced care planning is, as well as how and why you should do it. Welcome to Aging Insights. I'm your host, Melissa Chalker. Today, I'm joined by Dr. David Barile from the Goals of Care Coalition of New Jersey and social worker Laurie Powsner, who are going to walk us through the important topic of end-of-life planning. They're going to tell us about the tools and resources available to make sure that your providers, as well as your family, know your end-of-life care wishes. Welcome, Dr. Barile, to Aging Insights. Thank you so much for joining us today. This is a really important topic that we want to cover, and I'd really love for you to talk to our audience about what advanced care planning is and why it's so important. But before we jump into that, if you could just share with our audience a little bit about yourself and your background, and specifically about your role in creating the Goals of Care Coalition.
Oh, sure. Yeah, I am a geriatrician by trade. So I trained in internal medicine, and then I did a fellowship in geriatric medicine at Mount Sinai, and there got interested in palliative medicine also. So over the last 20 some odd years, I've had a practice in geriatrics and palliative medicine. And when I moved to New Jersey, and this was about 15 years ago, I was really struck by what I call the discord that existed at the bedside, where doctors were doing one thing and the patients wanted another thing. And it was more often burdensome care that was being offered, and the patient just wanted out of the hospital, or family wanted less aggressive care. Sometimes it was also ageism too, and the families would want more interventions and the doctors were prescribing less because of the age. So I began researching this and learning more about this problem at the bedside, and came across an organization called the Dartmouth Atlas. And the Dartmouth Atlas is an online publication that measures variations in healthcare utilization across the United States. And you can go to the Dartmouth Atlas and compare New Jersey to Montana. You can compare my hospital to your hospital. And what they've been able to demonstrate over the years, in regions of high spending, the health outcomes are worse. And in regions of low spending, the health outcomes are better. And so it's kind of interesting. And if you look at New Jersey, there's a lot of spending at the end of life. And specifically, if you look at the final 6 months of a senior's care in New Jersey, that senior during the final 6 months will spend more days in the hospital, more days in the ICU, see more subspecialists and more Medicare dollars spent than in any other state. So we are last on all these end-of-life measures. So Goals of Care was really a response to that. So we started Goals of Care years ago in an effort to improve medical decision-making at the final phase of life. And in the last few years, we've evolved into a coalition under the leadership of Laurie Feldstein.
Yeah, I greatly admire the work that you and Laurie are doing, and I think it's such a needed conversation. Specifically, we know that people have a really hard time talking about this, right? It's not something that you sit down readily and say to your children or ask your parent about. And so we know it's a difficult conversation. Can you talk a little bit to why it's so important to have the conversation?
Yeah, it's so important because the default of the medical system is to do everything we possibly can to prevent death, right? We have a very intense kind of rescue culture in our medical establishment in the U.S. And if someone does not have any written instruction to guide us, and they're unable to have this conversation, they will be brought into the hospital. They will be brought up to the ICU. They will have CPR, cardiac resuscitation, if there's no guidance and nothing that documents their decision. So this is the main message I think your viewers or listeners should understand. The default is to do everything.
Yeah, and I think that's really important to know. It's one of those things, if you don't say what you want, or you don't put something in writing, then like as you said, the default is to do everything, right? If we order food from a restaurant and we don't want mayonnaise on our sandwich, if we don't tell them, they're going to put it on there. The same thing. I hate to make that simple of a correlation here, but it's sort of the same thing. If you don't say what your wishes are, they're just going to do the default. And so, as difficult as the conversation is, it makes those end of life pieces easier, so no one is put in a hard situation of having to make a decision that they don't know what you would want, what you would have wanted, right? So we know that it's important to talk about it, even though it's difficult. So what are some of the tools available, or what is the Goals of Care Coalition stance on how to broach the topic using the tools available?
Well, first of all, before we get to the tools, I think that we just all need to speak more about this stuff. So doctors really need to better engage their patients and the patient's family members on preferences for care. We just need to embed it into the routine. We just need to do a better job of talking about preferences for care. And most Americans, I think, are willing to have this conversation. We want to talk about it. We want information about prognosis. And most Americans have opinions about this stuff. It's just that, we are a youth-oriented society, right? I mean, we kind of shun death and we don't want to talk much about it. So that's one of the main barriers. We need to, I think, better educate even young people, right, on self-determination and the ability to make choices in healthcare. And it's really entirely up to you. So we really need a culture change, I think, that should begin at the high school level in health class. But I think that we certainly need to do a better job in the outpatient office, just talking about this. Patients need to have these discussions with their family members. And when ready, then we should have documents for them. So my general opinion about this is absolutely most healthy adults should have a living will and advance directive. And there are some challenges with that, and we can talk about that.
Yeah, well, I'm glad that you've mentioned that, because I think people do think of advanced care planning or advanced directives as something that's only for sick people, and so right. I'm glad that you've made that point, that even a healthy adult should have this.
Sure. Yeah, and most people in this business of medicine and advanced care planning would agree that even healthy adults, 18 and over, should have a written advanced directive. And the challenge, though, that we have with advanced directives is that most of them are filled with legal mumbo jumbo, and most of them are complete. The majority of them, sadly, in the U.S., are completed by attorneys. And it's unfortunate, because when you look at that advanced directive, it doesn't give a lot of good guidance on what we should and should not do. And we also, the system doesn't do a very good job, our medical system, of looking for advanced directives and talking about them, right? We have situations often where it's several days into the hospitalization, and we finally think to ask the loved one, hey, does your loved one have a living will that we can look at? And then we hear rustling paper in the background, and they pull it up and we try to read it, and it's just filled with legal language. So the system isn't really built for supporting these documents. And so a lot of people are saying now, or kind of scratching their heads over whether it was really, if this is really the best way to go, to have these written documents. And I still think it is, because number one, on these documents, we can assign a healthcare proxy, a surrogate decision maker. And even if the advanced directive just does that, that's important, right? The other point to make about advanced directives, for those people who don't have one, I always tell them the research that's done on this. For those people that are in the ICU, that are critically ill or terminally ill in the ICU, if the doctors can reference an advanced directive that speaks to this situation, then the decision maker for that person, when they need to make that decision of removing life support, they have an easier time. And the chances of them having PTSD or depression in the 1 year following that decision is much less, right? If there was no advanced directive. So for those two reasons, assigning a healthcare proxy and reducing stress on family, it's really important to have an advance directive. I have an advance directive. And
I
the
do
night
too.
before, yeah, good. So, the night before I had some major surgery years ago, and I was out for 3 months, and it was really a big deal. And the night before I went to the OR, I showed my wife my living will, and we had that conversation, and I felt good about it. I
Yeah.
felt like at least I gave her some instruction.
Yeah. Life is unpredictable and we don't know what's going to happen. And so I think that's the driving piece there for your statement about even a healthy person should have an advance directive, because we don't know what's going to happen. And how much easier is it, not just for ourselves, but for the person responsible for making any decisions for us,
Right.
or the person who would be put in that place of making decisions, how much easier would it be for them if they know what we want at the end of our lives? So I think that's really terrific. Is there anything else you'd like to share with us about the Goals of Care Coalition, or anything that you all are working on right now that helps to bring this conversation to light?
Well, we're really focusing now on POLST and the POLST form. So for your viewers, POLST is Practitioner Orders for Life-Sustaining Treatments. And that is a single-page set of medical orders that ask about what the goals of care are, what the scope of care is, whether someone should receive aggressive interventions, whether they should go back to the hospital or not, and whether they should have CPR if the heart stops, right? So while we just said advanced directives are for all healthy adults, and that's true, even for frail elders, but the POLST form is built for and intended for that person in their final year or two of life. So during the pandemic now, we've been really focused on helping skilled nursing facilities, nursing homes, complete their POLST forms because of obviously the trauma and devastation that we've had over this past year, with not just frail elders being sent to the ER, but particularly important, those elders in the nursing home with no instruction on what to do, coming to the ER with COVID, terminally ill with COVID, and having resuscitation and placed on breathing machines. It's a real burden. So we've been trying to have this, we've been trying to encourage nursing facilities, decision makers, right, to have these conversations in advance of the event and complete the POLST form. So while advanced directives are for healthy adults, POLST forms, regardless of age, is for someone entering their final year or so. So your viewers can see a lot of what we're doing on our Goals of Care website at goalsofcare.org. And we actually have a lot of nice short videos to learn a little bit more about POLST.
I'm glad you mentioned the website. I was going to ask you to tell folks where they could find more information, because there are a lot of great resources there. And I know that you do some educational things as well. So if people are interested in videos or webinars or future events, to check out the website for all of that stuff. So thank you so much, Dr. Barile, for taking the time to join us today. Your expertise in this area is very valuable. And I know that our viewers have probably learned a lot from our brief conversation. So thank you.
Thanks for having me.
So, Laurie, thank you so much for joining us today. I'm so happy to have you here. As you know, we're here to talk a little bit and teach our audience about what advanced care planning is. But before we jump right in, why don't we take a few minutes for you to give our audience an idea of your background and your experience as a social worker?
Okay, thanks. Thanks for having me. I am a social worker. I've worked in a variety of settings. Most significantly, I worked with hospice for 20 years, and I'm a psychotherapist in private practice. And for the last probably about 4 years, I've been working with David Barile, Dr. Barile, doing end-of-life medical decision-making and helping people generally in the hospital and their families fill out POLST forms and other advanced directives.
Yeah, thank you. That is wonderful work, and it's such needed. In our conversation we just had with Dr. Barile, we talked a little bit about how this can be a difficult thing to talk about with families, and so we definitely want to get your, perspective on that. But before we do that, I'd just like to, for our audience, if you could explain what we mean when we say advanced care planning. What is that? What does it entail? How do we define advanced care planning?
So advanced care planning can mean a lot of different things, both legally, but what we're talking about today has to do with advanced planning around medical decision making, right? That's, yeah. So the primary things that are important, I'm assuming David probably went over this, so I don't want to repeat too much, are the an advance directive that is often referred to as a living will, and choosing a healthcare representative. And then if you are in a certain phase of life, we usually say the later phases of life, a POLST form or something similar. I like to look at advanced planning in a much sort of broader way, which is, I grew up in a family with a medical family. So we were talking about very detailed things from minute one around the dining room table. So that's definitely the way I lean. And it's always helpful when a family has had this as a part of an open conversation. For instance, someone that the family knows gets diagnosed with some dreadful illness. That is a great time to talk about how do you make the decision about what treatment to pursue or what treatment not to pursue, whether the person is young or older. If your mom has been saying for 20 years, I would never do chemotherapy, it doesn't mean that she won't, but she's certainly given you a sense of where she leans and what her basic philosophy is. The other one that I bring up all the time when I'm talking to people about POLST is, if you've ever heard a news story about someone, in a coma after a car accident, who's on life support, that is such a great opportunity to talk about your feelings about life support and what would you do, whether it's aggressive treatment or no treatment. And these are natural opportunities for people to sort of think it through and discuss it so that their family has a sense. The most difficult cases are ones where a word has never been spoken about this stuff. And that's just tough because that leaves family members sort of grasping to try and wonder what the person would have wanted. And it's just tough. It's a gift to your family to talk about it before you need it.
Yeah. Oh, thank you. Thank you for saying that. That is such a wonderful way to look at it. It is a gift, to look at it that way. And I'm sure you've seen a variety along that spectrum of dealing with patients whose families have talked about it or haven't, and anywhere in between, right? And I think you've given some great examples of some prompts to help you discuss this and bring it up with your family. But, in your role as a social worker, what are some of the tools or ways in which you've been able to bring this issue up for families, depending on where they are on that spectrum?
Yeah, well, for me, mostly I am dealing with it in a hospital, in a setting where something is actually going on. And I have the luxury of the structure of my job of saying, okay, so we need to have these discussions. People really need and appreciate guidance around, they need a lot of information. They need a lot of guidance around this. So mostly, I love what I do, and I think mostly people are very receptive to it. Maybe a little less so if you just see them in the supermarket and you bring it up, but when it's bedside at the hospital, people are searching for some guidance, frankly. And physicians and other medical staff are in the perfect position to do that. One of the things that I find most compelling and is the sort of the information people need most seems to be about things like the ineffectiveness of CPR. Everybody thinks, oh, of course I'd want that. Of course I'd want to be intubated and have a tube put down my throat to breathe for me. And once they get the information about how rarely that works, that has an enormous impact. And the other piece, which does come up earlier, that's so significant, is how many people don't ask their doctors, well, what are the odds that this treatment will work? And what would happen if I didn't do it? Because people are often really disappointed to find out that all that chemotherapy really only ever was going to give them another 2 months and at a decreased quality. So that's another place where it comes up a lot, is when you're offered a treatment to say, well, hey, let's get more information.
Yeah, I think that's an excellent point. Oftentimes, depending on your background or your life experience, some people are hesitant to ask doctors those kind of questions. They think, well, the doctor recommended this. I should just do it, right? And so I think that's a really important lesson for people to know, that you can ask the doctor, what are the statistics around this treatment? What will happen? And I think a great question is, what will happen if I don't do it, right? Yeah. So I think that you've been able to provide some real clarity and some suggestions for people here around that topic. We know it's not easy to talk about, but I think folks like yourselves who have a gift in talking to people about this can really educate individuals about the choices that they have and how to make them. So do you have any other tips or recommendations from your experience as a social worker on how to bring up the topic, or tools that you'd like people to know about?
How to bring it up? I mean, I think just being direct, whether you're talking to your parent or a parent it's so funny because I think it's the same number of people where it's the kid saying, Mom, we need to talk. And the same number of people where the dad's like, daughter, we need to talk. Like it's both, there's reluctance on both sides. And I often recommend things like Thanksgiving dinner as a time to actually bring up a hypothetical or a real situation and talk about it and say, okay, this is the situation. What do you think? What would we do? What would you do? What would you want us to do? The other important thing is it's really important for everyone to have some kind of an advance directive at any age. It's just critical. They hardly ever get used. Really, virtually never. But if it's needed, you want to have it. And the reason is, the most important thing is to pick a healthcare representative, a proxy, pick someone who's going to be able to make medical decisions for you, and to not just automatically pick your partner or your oldest child, but to pick someone that will do what you want. The other really important thing is, it's so common that people will pick a healthcare representative and not even tell that person, let alone share their wishes with them. So you want to be really clear that the person can follow what you want, because that's the law. It's not to do what they want. It's to do what they think you wanted.
Right.
And you don't need an attorney for these things. Very important. I don't know if David mentioned that. Do not pay. And I mean, if they're going to throw it in with the package with your legal will and the other things, fine. But otherwise, there are plenty of excellent forms available for free. And the only way I think that you would need an attorney would be if you know that your kids are going to fight and disagree. And, otherwise, this is super accessible for people.
Thank you for mentioning that, because we did cover it just briefly with Dr. Barile, where he mentioned a lot of the forms are very legal in nature. And so I think it's important to let people know that an advanced directive doesn't have to be all this legal language and complicated stuff. It should be something that is very personal, right? Can you just say maybe a little bit more about that for our audience?
Sure. I have so many opinions about advanced directives because I've seen so many. I find, and I think most doctors agree, the simpler, the better. Unless you are a medical professional, you probably don't have the knowledge to say, I want this, but not that. I want this, but not that. I want this for 5 days and then stop. I mean, it's too detailed. Plus, if it's too complicated, no doctor's going to actually read it. Or if they skim it, they're not going to be able to follow it. So it's most important to have a simple document that shares your philosophy. And I actually love the one that our hospital uses, which the way I describe it to people is, okay, so there's a spectrum. You're in a coma. You're on life support. Where are you on this spectrum? Keep me alive. You never know. There could be a miracle. I could wake up. Or if you cannot do it, don't do it. If you've already started it, stop it and let nature take its course. Just give people the idea of where you are on that so that your wishes can be roughly followed.
Yeah. That is wonderful advice, and thank you for sharing that with us. We did mention previously that the Goals of Care Coalition website has a lot of great resources where people can learn more about these tools and more about how to have the conversation. Are there any other websites or places you would direct people for more information?
I think that depending on, most people are in New Jersey, so Goals of Care is going to absolutely give you everything you need in terms of the POLST and tons of videos and great things about end-of-life decision-making. If anyone is here from another state, there are lots of good national resources as well. POLST is more specifically for people who are either nearer in their final phase of life or for people who have very strong feelings. I've known 60-year-olds who say, I don't want CPR. that would be a good person to also have it. I don't, nothing off the top of my head, but there's lots of good resources and tons that are free and easy to get information at. But I would definitely start with Goals of Care. Yes.
Great. Thank you so much for that. I'm sure they appreciate that extra added plug as well to visit their website. It is really a great, they do have great stuff there. So Laurie, I can't thank you enough for your time and your expertise. This is a difficult subject, but you make it easy to talk about. And I'm sure that the patients and families you've worked with appreciate that as well. So thank you for your time.
Thank you.
Thank you for watching this episode of Aging Insights. For more information and to watch previous episodes, please remember to visit our new website at www.njaaw.org and click on the Aging Insights page. We hope that you found this episode helpful. I know that I learned so much from our two guests. And don't forget to visit the Goals of Care website for more information. And for further information about senior services and resources in your community, remember that you can reach out to your county Office on Aging. Their phone numbers are listed on our website, or you can call the state hotline at 1-877-222-3737. And please remember, wear your mask, wash your hands, and stay a safe physical distance from others, but remain socially connected. Thanks for watching, and remember to tune in next time.